Back and hip pain is a fairly common ailment, but it's also common for people to not know what exactly is causing the pain. For people who face ongoing discomfort, one of the hardest tasks can be diagnosing the source.
Yeah, it's not terribly uncommon for someone to come in with a diagnosis of a joint pain somewhere, and it turns out the real problem is somewhere else. We don't want to just chase symptoms, so we have to try and figure out what's really the underlying cause, what's setting everything else off.
Craig Whitbeck of Dynamic Physical Therapy recently had to deal with that common problem, narrowing down the source of pain.
She knew she had back pain, but she really didn't know why, and she didn't know what was causing it. And so, just on her own effort, she tried to do a few things, and it kind of got worse. And then, so obviously coming in for therapy helped clear up a lot of questions and gave her an idea of what's causing it and how to adapt to that. And so, just even understanding the problem makes recovery a lot faster and easier.
The woman with the hard-to-isolate pain is Pam Neberdowski, who had a total knee replacement several years ago. In a case like Pam's, tracking down the real cause of pain and getting specialized therapy to deal with it is a vital part of the recovery process.
I feel more strength in my hip. In fact, I was able to report last time I visited that it's not waking me up during the night anymore, and that's really a giant step forward because that was pretty unsettling. And I think what I'm really pleased with is, as I mentioned before, this is a very different kind of therapeutic regimen than I've ever had before. And I like the fact that it's very specific to my concerns.
And professionals like Whitbeck say that finding and fixing the cause of pain is much easier for patients who come in early. But unfortunately, many people delay the recovery process.
If they come in once they get the symptoms, then usually we can get it to recover pretty quickly, but some people go for years with different kinds of symptoms, and so that can, of course, take a lot longer to address the problem.
For My News 26, I'm Kayla Kiley.